Welcome to DocTalks, Seniors and the COVID-19 Vaccine. My name is Jeff Malmgren. I'm with the Primary Care Networks and wanted to welcome you to this talk today. We're fortunate enough to have Dr. Jennifer Moore with us to talk to us today. We're really focusing on the vaccine itself and just really all the implications for seniors. I do want to point out that this is being recorded, and we will be making this recording available for you as well as for others after the event. It will be posted on the BurnabyCoronavirus.com website. There's also an awful lot of other resources there on that website, both about the vaccine and around all of the supports that are available for the community around the COVID crisis. Those are social supports as well as medical supports. In terms of the webinar today, we hope that you'll enjoy the conversation. Dr. Moore will give us some overview information that I think you'll find quite valuable, but then really invite your questions. Please, if you could put your questions in the Q&A box, that will be the easiest for us. If for some reason you can't use the Q&A box, you are welcome to put up your hand. My job will be to watch your hands, and sometimes I fail. So if you put it in the Q&A box, I do keep a pretty close eye on that. So, and again, the resources and this recording will be available later. So, without further ado, I'd like to introduce Dr. Moore. Dr. Jennifer Moore is a family physician in Burnaby, and she's also sits on the local leadership table in the Brentwood Hastings PCN Neighborhood Network, and also on the Primary Care Network Steering Committee. Welcome, Dr. Moore.
Great, thank you very much, Jeff. I guess you've obviously introduced me. I'm a GP in Burnaby, and I have been for almost 30 years now. When physicians typically give talks, they usually get up there and make a point of saying that they have no disclosures. In other words, I'm not funded by any drug company. I do, however, feel like I should let you know about my one bias, and that is that I am actually a senior. And for that reason, I am very pro-vaccines. I grew up in the era when, yes, I had some of those infectious diseases. I remember certainly having roveola as a child. I had a father who had diphtheria and basically missed a year of his life. I saw, and I had patients in the past with post-polio. So to me, the question about why vaccinate seems pretty obvious. However, I think we need to put all of this in perspective, because that's really what we're trying to do, which is to encourage people to get vaccinated so that we can ultimately get what we call herd immunity. So enough people get to the point where enough people either have had the virus or have had the vaccination that we don't really see it, or we see it only in a very minor way, and that we are able to treat it and therefore, prevent long-term sequelae, all the complications of the diseases, hospitalizations, and death. I don't know, I'm quite happy to speak directly a little bit of information on the well, I would say there's 3 vaccines that we're presently using. The 4th has been approved and is on hold. But I think too that we need to think all of these, data, and I will try not to give you too much data, but that you think of it in terms of this data is coming every day. It's changing drastically every day. Well, maybe not so drastically, although it seems like it. And that, everything is done to make sure that these vaccines are safe, and that they are reliable, and that they do what they say they are supposed to do. And there's lots of safeguards put in place. So every batch is always tested. There is what we call a cold chain. So these vaccines are followed from the time that they are shipped from the factory, even to the time that they get to the time that they're actually exposed to the air. And ultimately, all of the vaccines decrease 2 endpoints. That is severe disease, so these vaccines will keep you out of hospital. And I think you also have to realize that being hospitalized with COVID in many cases has led to weeks and months of long-term hospitalization, and also they decrease mortality. And that's really what, when they were running these studies, those were the endpoints. So even though you hear words about efficacy, and I can address that later if you wish, the endpoints that all of these testing, all of these vaccines were tested was against whether or not they keep you out of hospital and whether they kept you alive. As you know, of course, there are side effects that are pretty common to all these vaccines. And in fact, I would say also fairly common to other common vaccines that we get, like the flu vaccine. And those are largely local ones. You can get flu-like symptoms, you can get some pain at the site or pain in the muscle. You may have a headache or a mild fever. What I also found kind of interesting too was that the Canadian government site now also notes something called a stress-related reaction. And this primarily is the people who faint after they get the vaccine. And of course, they're trying to say that this is not specifically related to the compound that's being injected into your arm, but rather to the whole setting. And I think this is important to note, because one of the issues we always talk about in medicine is association versus causation. And so when we say that, I went and had the vaccine and I then felt short of breath and I was sweating and everybody said I was pale and then I had to go and sit down, that could certainly be associated with the vaccine, but it certainly doesn't mean that the vaccine caused it. So would you like me to go on and just talk a little bit about the individual vaccines and how they're made, and what the pluses and minuses are? Don't know if that's something people are interested in.
Maybe we could do if you did a bit of an overview on that, and then we can go to questions. I think that's great. Great.
Sure. So there are 3 vaccines that we're actively presently using: the BioNTech Pfizer, the Moderna, and the AstraZeneca. The Janssen or the Johnson & Johnson has been approved, but has not yet been used in Canada. I guess the one thing that is common to all of them is that the one, or not common, I guess I should say, but the one contraindication to all of them is if you've ever had an anaphylactic reaction. And by that we mean, develop shortness of breath, swelling, decreased blood pressure, nausea and vomiting, rash, to any of the components of those vaccines. I'm not going to tell you about the components. You can look that up if you go to the CDC, I think has them, and so does the government. Probably the only one that most of you would recognize and that mean anything to me is one called polyethylene glycol, or PEG. I've never had a patient who's ever had an anaphylactic reaction to that, but that of course doesn't mean that there aren't a patient population out there. And if I do get somebody asking me the question about anaphylaxis, I will direct them to the website, because it's a lot of chemicals. So, things like sucrose is on there, and potassium chloride. These are probably very unusual things that patients would have been allergic to. And it isn't just, that you ate or came into contact with one of these things and developed a rash. It's a true anaphylaxis. Now, having also said that, I understand that, patients who have certain immune deficiencies, and particularly, if they're seeing or they have, underlying diseases where they're treated with medications that may decrease their immune response. that's also very individual, and I usually encourage my patients in that situations to talk to their specialist about it, about, you know, whether the timing, whether there is any evidence for, you know, difference between these vaccines. So that's a very specialized population. Generally, as I said, there are not too many contraindications to any of these drugs. So the Pfizer vaccine, which was our first approved vaccine, is approved for people over the age of 16. When they did their initial studies, they did it on over sort of upwards, I think, of about 45,000 people. It was designed, and the trials were done where you got 2 shots, and the idea was to be 21 days apart. I just mentioned that because that's how the trials were done. They, as you know, subsequently have looked at the waning antibody response and said it looks fine now to spread it out to four months. So that's now become the reality here in Canada. It's and like the excuse me, like the Moderna vaccine, it's what we call a messenger RNA vaccine. So basically what they did was they made these, and I think it's really cute. Somebody calls it a jelly ball. So a little ball that they put a piece of this RNA in that codes for something called the spike protein on the virus. If you think about the virus sort of as like a circle, and these were little projections, it codes just to make that projection. And then what happens is this little jelly ball breaks apart. Out comes this sequencing that makes these spike proteins, and then your immune system says that doesn't look like me, and so it starts to make antibodies to the spike protein. So that's sort of the strategy for 2 of the vaccines. That's the Pfizer and the Moderna. The other ones are made by basically using what they call a vector virus. And this, I think in both cases, is actually an adenovirus. And adenoviruses are the viruses that cause colds. They particularly sorted through and nicely came up with ones that really have no effect, but are still enough that they cause your body to realize that this is something foreign and therefore build antibodies to it. So 2 different strategies. And I think, you know, people were always worried about, well, we don't have many messenger RNAs. I was going to say mRNAs, but that's what it stands for, messenger RNAs. We don't have too many of, that was not a typical strategy for our vaccinations. And so I think there was some feeling that, you know, this science was somehow sped up. And I think you have to realize that was not the case, that a lot of the science had been done many years. People are always looking at ways to make vaccines and better strategies, you know, strategies that either work better or have less side effects. And I think, you know, in modern times, you can think of a couple. We certainly, when we had our SARS outbreak over a decade ago, there was a lot of science done to come up with a vaccine. Fortunately, we didn't see SARS grow, didn't become a pandemic like it did here, or like it has for us. And so that science was shelved at the time. Ebola is another perfect example. They had the Ebola virus outbreak. They started making a vaccine to it, then it disappeared, and lo and behold, several years it recurred again. So this time they just simply went to the shelf, got out the science, and now we have a vaccine for it. So I think when we talk about any of these vaccines, you have to keep that in mind as well, that this didn't just come whatever our day of lockdown was, or our first community acquired case here in Canada. The science had been going on well before that. So the other, and I mentioned, of course, the Moderna is, again, a vaccine that we've used quite widely in this province. It's, again, for the ages over 18. I think when they come out, and you also have to remember that these indicators are because this is the age group that they did these stats, that they did these studies on, so they didn't do it on children under 16, or under 18 rather. But most of these vaccines now, they are running studies to look at the next age group, which is roughly 15 to 18, to see. Again, it's, you probably have read in the papers too about people talking about the efficacy. It's also a two dose, and the efficacy for some of these vaccines, the Moderna is around about 95%. That is after 2 doses. And it's also, and I think this is something we also need to really drive home, is that it does take 2 weeks for that antibody response to occur. So I think that's a message that we really need to be spread and be aware of. Same very much for the AstraZeneca, which, as you know, has come under some fire for quite a reason. It's also like the Moderna. It has an adenovirus vector that basically brings this coding information in for the spike protein and turns the body on to make antibodies. Also, and the last one is just the Janssen, and I think you might have heard that it's been sort of held in Canada. It's approved but held, again, also for the ages over 18. It's the one they've used extensively in the U.S. because, of course, it's made there, and it's the one I think that people were nervous about because it got reported as sort of being 66% efficacious. And again, as I said, I think you have to keep in mind that the endpoints were severe disease and death, not how many antibodies you made. And that's really when they're talking about efficacy. It's it's sort of a measure of how many antibodies you made, but also how many people, I guess, effectively didn't get the disease. But it's been paused because of some reports of something that's occurred in the U.S., which is a cerebral venous sinus thrombosis, and basically, it's a blood clot basically in the brain, I guess, to put it very simply. So they're looking in to see whether there's a significance, which of course also brings me back to the issue about the AstraZeneca. I'm sure everybody has been reading about the reason that we only allowed it to be used in the 55 to 65, although that's been dropped to the 70. And that was because of reported cases that originally, I think, came out of Europe, of an increased risk or possible increased risk of blood clots. And it took them a while to sort of, to kind of look at these cases and see if there was a link. And ultimately, the risk is very low. I think now the AstraZeneca vaccine was primarily used or is being primarily used, I guess, in Europe. We're obviously using it as well. But also it's being used widely in India. And I think they've given now worldwide somewhere in the order of 200 million doses of the AstraZeneca, for which they have had roughly, and it does change ever so slightly, but 30 to 40 cases. So when I was recently at a conference, and they were saying that when you give numbers, you should always use the same denominator. So I crunched some of these things, and which is the risk of getting this side effect with the AstraZeneca, which is primarily in the younger age group and primarily female. Your risk is about 4 per million doses, but the background risk in Canada of getting a blood clot is about 1,290 per million. And the risk of dying in a motor vehicle accident is about 23 million. And so the risk of a blood clot from COVID-19 from the astrazenca the risk of getting a blood clot from getting COVID-19 is about 147,000 per million, and about 800 per million will die of COVID. So I think we have to try to keep those numbers low. There is some suspicion that there's a genetic link, because there was certainly a cluster of these cases were in Germany and in Norway. And as I said, they've had none in India, where they've probably given at least probably 10 million doses now. Although, you know, to be quite honest, speaking to somebody who works on the Indian pandemic, their numbers are probably, not that they're inaccurate, they're just probably underestimated. So that's my little spiel on the actual vaccines. I guess there's just a couple of other sort of important things briefly about that comes out, is that you have to be aware that these vaccines, you do take a couple of weeks to actually develop the antibodies. And what I found astounding was to find out that we had 400 cases of COVID in individuals who had had a vaccine and within 14 days had developed the disease, which is not to say necessarily it was vaccine failure, but because many of those may have been infected before they got vaccine, because we are going into hotspots and vaccinating people. But I certainly hope it's not because people assume that they are now immune and can sort of start avoiding the restrictions, and, you know, not washing their hands as religiously as they did, not wearing masks, not social distancing. So I think we have to really keep that in mind, that it's not a panacea, that it isn't a ticket to say now you can go see your grandchild. And the other thing too that I know I've had to speak to my patients about is that they don't want you having any other vaccine within 2 weeks. So which mostly because you've probably hearing everybody's taking this time, I think, to step back and think about what vaccines they haven't had, whether they have, if they're over 60 or 65 or have certain medical conditions, about getting the pneumonia or even the Shingrix, which is the shingles vaccine over 50. But the recommendations is that you have none within 2 weeks. So everybody's listened to me long enough. So some questions.
That's great, thank you. And there are a few questions, and I have a few myself. It's interesting, anecdotally, I can say that my mother-in-law, who's 92, was vaccinated, and within a week she did get COVID. But she had no symptoms. So, and I mean, you know, again, we don't know whether it's whether one leads to the other, but you tend to think that may be the case, that getting the vaccine helped and helped with the severity of the. That's my understanding, is that for folks who get the vaccine, even the first vaccine, it reduces their likelihood of going into hospital by, I've heard, as much as 100%. Is that true?
Yeah, I haven't seen that particular figure recently, Jeff, but I know it is quite significant. I think the other comment too is that there's still some belief that patients who have had the vaccine, even if they don't actually get the virus, may still be able to shed it. So, you know, again, just back to our question, you know, the issues about social distancing and hand washing. And of course, really, I think the proof is in the pudding on that one, because, you know, we haven't had a flu season that we could call a flu season. And so, you know, social distancing and hand washing make a difference.
Yeah, and I mean, and it kind of goes to you asked about, or you mentioned that, but it's that you know, particularly for grandparents, it's when can I hug my grandchild again? Now that I've had the vaccine, does that mean I can hug my grandchild again? And how do you answer your patients when they ask you that question?
Well, ideally, I'd like everybody in that bubble to have had their vaccine, I guess is the bottom line, and have had it for at least 2 weeks. It doesn't mean you get it on a Saturday and Sunday you have a family gathering.
Yeah, because it does, and I guess people do really. There is a tendency to really, sort of, okay, now I can do this. I've been waiting for a year and a half, and now I have the opportunity to do it. Yeah, it's. I mean, it is. You mentioned it, but I mean, is there any reason that you should be less that you should be sort of be less stringent about your hand washing or your face covering or those things once you've had the vaccine?
No, and I suspect, I suspect the masks might be around for a long time. In fact, maybe it's not such a bad idea. Maybe in flu season, if you get a cough or a cold, or all of which we have not seen, or at least I haven't seen much in my practice. I can't remember the last time I treated anybody for, a bronchitis this year, for sure. Maybe that is something that we should be saying, if you are going outside in any circumstance, or you're going into, whatever, do a shopping, or you're going into a building where you can't space, that you wear a mask if you have a cough and the common cold.
It's changed our world. There's a question here, and I think it's a question about. There's two pieces to it. One is, how important is it for seniors to get the vaccine, and the other is one shot enough for seniors? And I think there's another part of this, which is we were kind of chatting about before we came on the call. Is some seniors are feeling like maybe I should wait and get it, so that the people who are who need it more can get it. How do you answer those questions, Dr. Moore?
Yeah. Those are fairly difficult questions. I think, Tony Fauci sort of said, if you can get the vaccine, get it. And I think that really should be the line. I mean, we now have such, a multiple pronged approach to it that it's hard to advise somebody, because, maybe it's a teacher who's expressing that. And yes, fortunately, not the schools haven't been our big hotspots. But the bottom line is that, ultimately we want everybody vaccinated, for which we know these vaccines are safe. And so I think if you have the opportunity, you should do it. Several patients got called or got it, quote, early, because they were taking an elderly parent, and that particular day they had 1 or 2 extra doses. I know originally when they were doing it in the hospital, they'd go into Emerge and see if anybody there, sort of qualified. The point is to get the vaccine out, to use the vaccine and get it to as many people as we can. I guess the other thing I neglected to say when I talked about the little jelly ball, and the reason I use that, I think it's a good analogy, is because, as you know, I mean, these vaccines, and this is the reason, I will never have the Pfizer in my office, is because it has to be kept cold, and doesn't have to be kept cold, quite as cold as we originally thought. But secondly, it's what we call jiggle sensitive. So it can't be shaken around and moved. You can see, because you need to put this jelly ball around it so that it dissolves once it gets into you. But on the other hand, you can see that if you shake it, it probably does open it up. And therefore, you're just putting in something that by that point probably is not essentially living, I guess. So
it's not a very transportable vaccine,
right.
Is what it comes down to.
Yeah.
One of the things I think you touched on, but we didn't touch on too deeply, is around the variants, and of course they're the conversation of the day. And I think that there's a conversation around the vaccines, and is around which vaccine is better. And I think you've answered that as the best vaccine is the one you can get in your arm right now. But is there anything that's coming out around the variants as to whether or not there was one vaccine might be better against one variant than others?
Yeah, I think the Moderna, or not the Moderna, sorry, the Pfizer has some evidence to show that it's good against the British variant. So that one is coming. It's interesting. As I said, I was at this talk that Deborah Money gave, and she made the point that all of these labs now are retooling and getting ready to adjust their vaccines to deal with the variants.
Yeah.
Like, this is the speed with which the science is happening, because, as you know, there's been some question about how good they all seem to have some efficacy against the variants to date. But I liken it to the flu vaccine. The reason we get the flu vaccine every year is because it is a vaccine that is constantly, or not a vaccine, pardon me, it's a virus that's constantly changing. And we also get different strains of the influenza A from year to year. And so I think, and I think we have to view the COVID virus in the same light, that it's going to keep changing. The variants probably doesn't change quite as quickly as the influenza, but it does. And so, it's not like the science wasn't anticipating that this might happen. It's just trying to stay ahead of the virus.
So that leads to a question of how long will this vaccine last? And I know it's one that's hard to answer. That's the research that we're all going through, isn't it?
Yes, that's right. Well, we know it lasts for at least 4 months.
Yeah.
Because that's the reason we're saying the second dose. That's a very good question. Would I be surprised if at some point in the future I'm giving flu vaccines in one arm and a COVID vaccine in the other? No, I wouldn't be surprised. But I don't know that there's the science there. I suspect that this is not a virus that's going to completely die out like we saw with the SARS, but yeah, I don't know that for sure.
And I think that you've answered this, but I think that it comes up again: are both shots necessary? And it's like what I heard you just say is, we only know that the first one's going to last for 4 months. Seems like it's pretty necessary to get that second one.
Yeah.
Yeah. There is a question about and there's also a question about, is there one vaccine that's better for seniors than others? And again, what I heard you say is there's the best one that will be the one to get right away. Is that right?
Yeah, absolutely. And preferentially in this province, we've used the Pfizer and the Moderna in that age group, simply because that's what we negotiated and we could get. We don't make vaccines, unfortunately, in this country, and maybe that was. I don't think the history is particularly political on that issue. We used to have Eli Lilly. We used to make vaccines here. We did some of the early polio research, but at some point it probably wasn't economical. So, if you want to go to the drug companies and say, "Hey, why don't you make vaccines in Canada?"
Yeah.
That's really where the issue is. And we do have a vaccine repository here, and this was a worldwide thing that was set up with the intention that the countries that could afford it could supply vaccines to the countries that couldn't. And I think we've used a little bit of that, in this time to try to keep our supply up. So.
And it sounds like they may actually be starting to build to manufacture vaccines at some point in Canada again, which is a wonderful thing. There's some questions around anything that might preclude getting a vaccine, and I think there's one question: is should seniors with chronic medical conditions get the vaccine?
Absolutely. Yeah. They're doubly high risk, right? A, because they're seniors, and B, because they have all the the other medical conditions, or quite often have some of the medical conditions that would be more likely to put them into hospital, or in fact cause death. Sorry, what was the first part of that question?
Well, that's really the question: should seniors with chronic conditions get that? And actually, someone was asking specifically around AstraZeneca, and it would seem like that's the chronic condition doesn't preclude getting the AstraZeneca shot.
Yeah, and in fact, the blood clots primarily have been in young women, and usually under the age of 30. So. Otherwise, it's as I said, it's been used. It's it was developed in Oxford, so it's the main vaccine they use in the UK. Again, it's also it's also common. It's also primarily being used in India because that's where they're manufacturing it. So.
Yeah. So, and you talked a little bit about allergic reaction. Obviously, that's one good reason not to get the vaccine is if you have an allergic reaction. Are there any other conditions that would preclude getting the vaccine?
Not that I could really find, Jeff. It's sort of a tricky question because, so for instance, if a patient's undergoing chemotherapy, they may not want them to get it today. They may want them to get it between. And this is why I'm saying is for these sort of specialized situations, I really had to defer to my specialist colleagues, and even they don't seem to be always 100% consistent. You know, some of them prefer, so I have a few patients with inflammatory arthritis, and, you know, they're saying, well, don't get it on a day that you're taking your methotrexate, or which is an immunosuppressive drug. So, you know, there probably are sort of those other, but those are probably more timing issues. I think overall those, we want those patients to get them. But I think if they're, you know, I think as I say, that's the particular one I can think of off the top of my head is around the chemotherapy.
Yeah, I mean, it kind of leads me to a question around the reaction to the vaccine, and it does seem that it's person dependent rather than vaccine dependent. You talked a little bit about it, but is there, you know, I mean, can you talk just a little bit about what the range of reactions, particularly for seniors, are, just so that people wouldn't feel some comfort even if they feel awful?
Yeah, well, you know, I always think this is you know, interesting because I try to poll my patients on this. You know, I've always read the side effects of the influenza vaccine, and yet my over 65 crowd all seem to be lining up to get the flu vaccine every year. And when I've asked many of them if they've ever had any side effects, they kind of look at me and say no. And yet, you know, I've had my 45-year-olds telling me they got numbness and tingling in their feet, or they, you know, they were sure they had a fever and they woke up and took their temperature in the middle of the night and it was, you know, 37.8, where 37 is considered normal, I guess, as it were. You know, it's a you know, it's a wide spectrum. I would say the feedback that I've had across the ages for many of my patients have usually the most common one has been some soreness at the site, that the muscle was sore in the arm. Maybe they had difficulty, you know, for a couple of days doing the lifting or something. I know I've the Moderna too. I've had a few comments. Now, not too many people in the Lower Mainland have had the Moderna. These are mostly coming from the north, which is primarily where we're sending it, and often in healthcare workers who did in fact get 2 doses and found that the second dose they did get more of the kind of achy arthralgias and kind of the fever-like symptoms. But again, it was short-lived. You know, you're talking about 12 hours sort of thing. It wasn't, and probably totally treated with a, you know, a Tylenol or acetaminophen if they needed something. So very, very short-lived. Yeah.
This is another one. I mean, it kind of goes to, are there anything that might preclude getting the vaccine? This is someone who's related to somebody who only has one kidney and it was by birth. Is that a risk factor, or is that the kind of thing that would be considered a risk factor?
Yeah, well, I think if they have a, you know,
it's hard to answer. It's a very specific.
Yeah, it is hard to answer. Certainly, if anybody has had a kidney transplant or has only one, they did put them sort of into the, you know, the CEV crowd. But there's people you're going to miss just because the way the province tried to get those letters out was looking for several things that would trigger it. So if you were diabetic and you were on insulin, for instance, you got a letter because they could get that through pharmacies. I know when they looked at, they did look at discharge summaries. And so if you were lucky enough, even if you'd been in hospital because you had a hip replacement, but somebody had written in your history that you'd had a splenectomy, that sometimes would trigger it, but it had to have happened in the last couple of years. So yeah, it's hard to pick those patients up. I guess what I would say ultimately is yes, we're hoping everybody gets the vaccine. How you prioritize something like that, again, I think is very difficult. And I know at some of the sites they were trying to accommodate people who were saying, look, I'm 64 or something, but I'm looking after my mother who's 85. Can I get the vaccine? And I know some of the sites were saying, okay, just go ahead and do it. It doesn't make sense to have one vaccinated and not the other. But I also know that people trying to take advantage of that and bringing whole families, and ultimately they had to get fairly hard line about it. So. But as it's rolling out faster, I think we're picking up those caregivers anyway. So, all right.
It does seem that some of that has been about supply and demand as well. As if they know that they have a fairly large supply, they're willing to be a little bit more liberal. And when they see the sort of the things slowing down a bit, then they clamp down a little bit. That's what it feels like up there. That kind of goes to a question about how do they set these arbitrary, someone's asking, I'm 55, I'm 54, and I can't get the AstraZeneca. How come it's okay for the person who's 55? Why is it, how do they come up with those lines? Got a good answer for that, Dr. Moore?
Well, the good news is you can now.
Yeah, that's right. If you're 39, you're out of luck, but if you're 40, yeah.
I mean, I think I think you have to realize that, the Canadian government is really, really, really trying to be absolutely as safe as they can be about any of these vaccines. I think you have to keep that in mind. And so even though they've given millions of doses, and as I said, it's the primary vaccine in both India and the UK, and they have, really big numbers on them. When this concern came out about these blood clots, and the primary age group that it seemed to happen in was females and younger females, they said, well, okay, we were going to have to restrict anyway the numbers because we only have so much vaccine. So how do we do that? Probably makes sense to go with the 55 to 65 because, in fact, AstraZeneca did their studies on only people up to the age 65. And you say, well, why did you do that? Well, when you're looking for 45,000 recruits, you need people to be able to get to your vaccine sites. You need to be, if these are people in long-term care facilities, there's a whole other, complicated issue there. So these were primarily people who were willing to, get these early vaccines. And so, their data is really robust for the 55 to 65-year-olds. So and that's why now they've gone down to 40, right? And it's because, we were worried that we were going to end up not using vaccine, and that shouldn't happen.
And have gotten more and more data about how safe it is. Yeah. I mean, unfortunately, it's made everybody a little curious about all of the vaccines, but hopefully we're overcoming that. Here's a question that we were talking about a little bit before. I've had my first dose of Moderna. Being that this vaccine is in short supply, can I get Pfizer as the second dose? He didn't ask. He didn't say AstraZeneca.
I can assure you, somebody's working on that.
Yeah.
This question does come up. There isn't, I don't even think there's any yet preliminary data, but they certainly are working on it. And for exactly that reason, for the countries to have guaranteed supply like but it's that now, of course, the government announced last week that we were actually going to get more doses, that they've secured for the next number of months. So, I just say stay tuned, but and don't get panicky yet about it.
Yeah, there will be an alternative out there. Yeah, there's a question here about hydroxychloroquine. Do you have any opinion around HCQ hydroxychloroquine? That you'd care to share?
Right. Well, I think I'm not exactly sure what context they're using it in. Are they using it as the Trump preventive, or are they using it as a treatment for?
You're asking if you've heard of it.
Neither one of those have shown to be at all in any way helpful. Period.
Right.
And believe me, you can go on to any of the big major medical journals just about every day and find something about how to fine-tune treatment for patients in hospital with COVID and those outside. The other thing I think that too that people should be aware of, and I found this just I stumbled across it that the government of Canada has made it illegal to sell any unauthorized products or make false or misleading claims to prevent, treat, or cure COVID-19. And they do actually publish a list. So they're serious about these kinds of things that get sent around by all the social media.
Yeah, well, I mean, and I think that's it. That's the fear is that people will trade on people's fear because people trade on people's fear. So how else can, I mean, that's why we do these things as well, to try to
Yeah.
alleviate fears and make sure, I mean, again, you pointed out those stats around the risk involved in vaccine and it seems like when they're countered without data. And that's the fearful part. I see even Facebook and the social media folks are basically pulling stuff down now or flagging stuff when they say this it doesn't have data behind it, which is absolutely good to see. There's a question around data which you may or may not have. It's around the efficacy of the Moderna vaccine. What do you know after this? They ask what the efficacy is after 2 weeks, but basically what I heard you say, you may not have that number,
Yeah.
but I heard you say that it really takes that full 2 weeks, and I've sometimes even heard 3 weeks before the full efficacy kicks in.
Yeah. No, absolutely. And so, I think that's, as I said, just the caveat that we have to keep remembering that even once we've had that first dose of vaccine, we can't be guaranteed anything for the first couple of weeks. And as there will still be people, even vaccinated, even if they got the 2 doses and they got it at the 21 days or they got it at the 26 days or whatever it may be, who still get COVID. But we know that they're very unlikely to get admitted to hospital and that they're very unlikely and they won't die of it.
Yeah.
Is the bottom line.
Yeah.
And it probably will be a milder illness for sure.
Yeah, and that does see, which is so all the more reason, absolutely, go out and get a shot. And it's getting, I mean, I will speak just a little bit to the, you can, there are hotspots that you can find out about. Go to the Fraser where everybody can get a vaccine. You can go you should be able to sign up easily if this is mostly seniors, but everybody, almost everybody now can register. In Burnaby, we have both the Fortius site, which is a walk-in site that's doing, I think, up to over 1,000 vaccinations a day. And now we have the BCIT site, which is a drive-through site, which hadn't been doing vaccinations, but I believe they're also starting to do vaccinations and they're doing testing. So there are multiple options. There's some questions around, if I missed my sign-up window, you don't lose the opportunity. I think that what the advice we're hearing is if you can do it in your sign-up window, that will make it an easier process. But if you've waited beyond your so-called sign-up window, that should not deter you from getting signed up. Yeah. You should also know that if you have any problems with getting signed up and you want help, the folks like many of the community agencies, Burnaby Neighborhood House will happily help you, and ISS and Mosaic will help you to go online and get signed up. If you don't have an email address and you go to Southside Church on Thursdays, they'll help you to sign up, and the library will supply you with an email address, and the library will also happily help you to sign up if you have an issue. In terms of getting rides to the sites, if you contact Fraser Health or HandyDart directly, they're working to get folks get rides to the site. Again, also the agencies in Burnaby, any of the community agencies, Burnaby Neighborhood House, ISS, or Mosaic, or Burnaby Family Life, or Burnaby Community Services. If you contact them, they'll do their best to figure out a way to get you to the site if you need that. Don't make it a deterrent from getting to the site and getting vaccinated. So there's, again, I think that Dr. Moore and I were talking briefly before this started today, and it's, I think Andrea had some stats around every day you wait increases your chance not just of getting COVID, but of dying by COVID exponentially. So there's no reason to wait. you're not saving yourself or anybody else if you're waiting for a vaccine. So we don't have any more questions. I just, before we go, Dr. Moore, would you like to, anything you'd like to say to sum us up?
Well, I guess basically bottom line is get vaccinated. I also make a plea now because I'm always worried about the patients that may fall outside of some of these categories. Or, I talked to one the other day who, he lives alone, and I think he just hasn't gotten into any of the mainstream and really didn't know how to. He's quite computer literate, but he didn't actually know how to sign up, and his age group has gone by. So, that's one person. But if you know anyone, you have a neighbor or whatever you think might not have, been listening to whatever CBC or to the radio or has access. If you know anybody who you think should have signed up for a vaccine and hasn't, just, the bottom line is to keep spreading the word. I know when they went to the central booking, it was a little bit confusing because initially you were told you had to do it by age group. Now the bottom line is you can go on and register, and they will send you a message when you can actually then get an appointment for a vaccine. So, and you can do that at 2:00 in the morning. There's no, you don't have to talk to anybody. It's simple, and I think everybody should just be thinking in those terms of getting themselves registered so that when their time comes up and if vaccine becomes available, this is the other way, of course, that allows them, if they look like they're going to have 10 extra doses at the end of the day, they can call people on short notice and get them over to the vaccine site. So, just keep thinking everybody you run into, have they had their vaccine?
Great. Thank you. Well, thank you, Dr. Moore. That was wonderful. I do want to remind folks that, yes, the information is, here's you can take a quick look at this. There's lots of information there. This will be available on the BurnabyCoronavirus.com website, this presentation. So you're welcome, obviously, to view it there and to share it with your with your friends and with your relatives, for people who would like to get this information. And I guess, again, I just want to echo, as Dr. Moore said, the best shot is the one you can get right away. So we will look forward to seeing you all in the future. Again, thanks, Dr. Moore, and thanks everybody for coming along.